I had a total knee replacement about 1.5 years ago. I had nothing but trouble with it, had to have pain management, injections, all kinds of stuff. I was rehospitalized twice. I had a lot of pain, a lot of swelling, and a lot of fluid in there. And so that was my right knee. And so I came to one of the little seminars they have here. And they wanted to replace my left knee, which they said was worse than my right knee. And they said it was bone on bone. And so that was also a problem for me. Plus I had this little knot in my lower left back, and I had burning in my hands because I guess I have like arthritis, and I use them a lot. And so I had the stem cell injection in 5 places. And you come to these things, you think, oh, that really sounds good, but all these people are a bunch of liars. But the truth is that my right knee, although it still has some mechanical issues, I have no pain, no discomfort whatsoever, which was kind of like a godsend. My left knee we injected anyway because there was a little bit of cartilage left. And I gotta say that I think that's better. There's still some issues there, but it's only been 6 months. My lower and left back is like perfect, and my hands are, I'd say, 90% better. Every now and then I have a little trouble because I do upholstery and stuff like that. But if you can afford to do this, or if you can't afford to do it, it's the thing to do. If I think about all the money I had to spend outside of my insurance just to deal with trying to manage that pain, to not having any pain, I'd say go for it.
So I'm here with Craig this morning, and Craig here is for the re-examination. And so Craig had his left knee replaced about 3 years ago, and then his right knee was going on the way to being replaced, and then he decided to do the stem cells. So Craig, take us from where you were 3 months ago to where you are today in your right knee, which was not replaced, and then your left knee that was replaced.
On the right knee, I was having a small amount of pain just daily, and the more I was on it, the more pain I had by the end of the day. I came to the stem cell seminar, and it sounded really interesting, but when I talked to Dr. Patrick at the end of it, he told me about a gentleman that had a knee replaced and was needing the other knee replaced, and they did a partial injection in the one that had been replaced because he was having some issues still with it. So that kind of interested me because I was having some aches and pains in the one that had been replaced. So I decided to do it, and now it's been 3 months and I'm back from my first follow-up. And my right knee, which was going to need to be replaced, I've got no pain anytime during the day or even after a full day on it. On the left knee that was replaced, it's much, much better. Right now, if I'm sitting like I am here on this table, I have a little tightness on the left side, and at the end of the day, it might turn into an ache, but that's probably 5 times better than it was before the injection. So at this point in time, I'm a happy camper.
Awesome. And did you tell me before a couple minutes ago, Craig, that you were rubbing cream on your legs nightly for the pain, and you no longer have to do that?
Yeah, and as a matter of fact, I even had to do that a little bit after the injection. It seemed to be a while for the injection to work, and it was only about a month ago or 2 months after the injection that it really seemed to be working, and now it's just great. So the last month has been great.
I had it done September 30th and had 75% put in my right knee, which one doctor was talking about I needed a replacement. And I had a replacement in my left knee and had 25% put in that knee. 2 days after the injection, I had no pain in my left knee, which had been painful for 13 years. My right knee is to the point now where I wouldn't consider having a surgery of any kind.
So even after you had the knee surgery, we injected the left knee,
Right.
and you had the pain for 12 years.
Yes.
Okay, and on a scale of 1 to 10, how bad was your pain in the knee when you had the actual artificial knee put in? So how bad on a scale of 1 to 10 was the left knee?
I would say a 5.
Okay.
My tolerance for pain is higher than most, but I would say a 5.
Okay, and then how about the right knee? On a scale of 1 to 10, pre-stem cell injection, how bad was the right knee?
It was not quite as bad, but it was getting there. I'd had it injected with cortisone 2 or 3 times, and it was lasting less
Okay.
less relief each time.
Okay. Now today, 3 months later, Gene, tell us on a scale of 1 to 10 how your knees are regarding their pain.
No pain whatsoever.
So no pain
No pain.
after 3 months. And Gene, how old are you?
I'm 75.
75 years old.
Yes.
And your wife Cheryl texts me pictures up and down ladders. How has it changed your life as far as your living and the activities of daily living?
Well, I've told her we're planning on going to Florida for a month or so, and I've plan on renting or buying a bicycle while I'm down there, which last year we bought a lift chair to help me to stand up. And this year we won't need that at all.
Wow. So no more lift chair. That's great. And then, Gene, would you recommend the stem cell procedure to other patients that are contemplating this procedure?
Wholeheartedly. That's the best money I've ever spent.